Hello, I'm Dr. Khalilah Jefferson, DNP. Today I want to talk about one of the most complex and important challenges in modern healthcare leadership, leading across generations in nursing. Right now, many nursing teams include Gen X, Millennials, and Gen Z working side by side. Each group brings strengths, values, and expectations shaped by different social, educational, and professional environments. Effective nurse leadership today is not about choosing one generation's preferences over another. It is about creating systems that allow all generations to perform well together. Let's start with Gen X. Gen X nurses often value autonomy, efficiency, and competence. Many were trained in environments that emphasized independence, hierarchy, and figuring things out on your own. They tend to appreciate direct communication, minimal micromanagement, and clear expectations. Now let's look at millennials. Millennial nurses often value collaboration, feedback, and purpose. They tend to want to understand why policies exist, not just what the policy is. They respond well to coaching, mentorship, and opportunities for growth and professional development. Gen Z nurses are the newest group entering the workforce. They are highly comfortable with technology, often value transparency and psychological safety, and tend to expect frequent communication and support. Many Gen Z nurses place a strong emphasis on work-life balance and mental health, and they are more likely to speak up about burnout or system issues. Leadership challenges arise when these differences are misunderstood as weaknesses rather than contextual differences. For example, a Gen X leader may view a Gen Z nurse's need for feedback as dependency. A Gen Z nurse may view a Gen X leader's directness as dismissive. Millennials may feel caught in the middle, expected to adapt upward and downward simultaneously. Effective nurse leaders do not label these differences as problems. They translate across generations. One evidence-based strategy is standardizing expectations while individualizing communication. Clinical standards, patient safety protocols, and performance expectations should be consistent for everyone. How leaders communicate those expectations, however, can and should vary. Another critical leadership skill is psychological safety. Research shows that teams function best when staff feel safe speaking up, asking questions, and reporting concerns without fear of humiliation or punishment. This is especially important for younger nurses, but it benefits all generations. Strong nurse leaders also avoid generational stereotypes. Not all Gen X nurses dislike feedback. Not all millennials need constant validation. Not all Gen Z nurses are fragile or disengaged. Leadership requires curiosity, not assumptions. One practical approach is creating structured feedback systems. Regular check-ins, clear onboarding processes, and transparent communication reduce generational tension by removing guesswork. Mentorship across generations is another powerful tool. Experienced nurses pass on clinical wisdom and institutional knowledge. Younger nurses often contribute new perspectives, technology skills, and updated evidence-based practices. When leaders intentionally foster mutual respect, generational diversity becomes a strength rather than a liability. The role of the nurse leader is not to force uniformity. It is to align diverse individuals toward shared goals, patient safety, team well-being, and professional excellence. Leading across generations is not about age. It is about adaptability, emotional intelligence, and systems thinking. When nurse leaders understand this, teams are stronger, retention improves, and patient outcomes benefit. Thank you for listening.